Welcome to Health Pulse, conversation with healthcare leaders who are shaping how care is delivered and how teams are supported. Hello, everyone. I'm Rupal Patel, and today I'm joined by Ashley MacLennan, founder and CEO of MedCurate. Ashley brings a rare perspective. She's led hospitals as a COO and CEO, and now she is building a company tackling one of the healthcare's biggest problem, which is staffing. So, first of all, Ashley, welcome to our podcast. And before we jump into anything, where are you joining from today?
Yes, thanks so much for having me. I am joining you today from Kansas City.
Awesome. And I hope there will not be any snowstorm there.
Yeah, a little bit. I'm looking at the snow on the ground right outside the window. But kids are back in school today, so that makes it a little bit easier for everyone.
Okay, and I think that might keep you busy in this week.
Yes,
Okay,
absolutely.
great. So before MedCurate and before hospital leadership, where did you grow up?
So I'm actually a native of Kansas City.
Mhm.
Moved a few times when I was really young, but finished kind of everything from elementary school through high school here in Kansas City before moving to Texas for undergrad and graduate school.
Okay, awesome. And was there a healthcare always the plan, or did you stumble into it?
So growing up, we actually had a family friend whose husband worked with my father, and she was a hospital administrator. So her name's Jody, and she was one of the few females that I observed growing up that had a career and something that they were incredibly passionate about. It wasn't just a job, it was a career. And so as I was going off to undergrad, it always stood out in the back of my mind that that could be a potential career path where you could blend
Hmm.
business and healthcare, which most people, when they think working in hospitals, they think doctors and nurses and don't necessarily know what that business path looks like. So I'm really grateful to Jody for showing that to me at a very early age.
Awesome. And I like that it's not only just healthcare, it's not just the clinicians or physicians or nurses, I think. And we'll explore more like, what we have done and what you've been into it. So, but I like that energy. So,
Yeah.
what's something about you that never show up in your LinkedIn bio or we cannot find about you on social media?
Oh, okay. Let's see. Well, I am bilingual in Spanish. My first job to get my foot in the door, we all have to get our foot in the door somehow. And
Right.
I thought I wanted to go into healthcare leadership and wanted to start working at a hospital, but I was still an undergrad, so I didn't have a degree and I wasn't clinical. So my first job, I was actually a Spanish interpreter at a children's hospital in Dallas. And you have to acknowledge it was somewhat humorous when I'd walk in the room and tell these families that I'd be their interpreter. I think they wanted an alternative interpreter, but it was great for me to learn how a hospital operates and hear it firsthand from the families and frontline clinicians that were taking care of these patients and their families.
That's interesting, especially. Yeah. So let's talk about your professional arc because it's pretty unique. So you went through a CEO development program, eventually you become a three-time CEO, which is awesome. What did those roles teach you about how hospital actually works or operate?
Yeah, so I had the good fortune of going through HCA Healthcare has a COO development program. And if you're fortunate to get in, you get training on site at the corporate office in Nashville for HCA, but then you also get progressive responsibilities and projects at a local hospital. And so through that, I was a COO in training, basically, for almost 2 years, where I worked alongside the COO, seeing what their average day was like, and then taking on some of their responsibilities as I was able to perform at a COO level. And then graduated from the program and took my first COO role in Dallas at a community hospital. And what I learned there was some of the balancing act of the community-based hospital that wants to meet the needs of their community and not have patients and residents have to leave the geography for, mild to moderate acuity of care. And so figuring out what's the right balance of specialties and acuity to keep at the facility versus when it becomes very highly acute, highly specialized, when to send to a subject matter expert at a larger area or academic medical center. I learned I really loved that environment
Hmm.
because a lot of the employees at the organization live near the organization and are taking care of their friends and neighbors and classmates and things like that. I then became CEO at that same facility, so had a good tenure there and really built strong
Awesome.
relationships in that community as well. My next CEO role, I was asked to go to Houston, and I was the CEO of the Women's Hospital of Texas, very large women's and children's hospital in HCA's portfolio. The second largest, I believe, from a NICU perspective in the country, after Grady, which is a hospital in Atlanta, Georgia. And there I learned what it's like to follow a CEO who had been there for 20 years, who was beloved, who did incredible work to grow the organization. And so had to determine how I would lead in a way that
Hmm.
honored all the work that the previous CEO and their team had done, but also help bring the organization forward for that next generation of growth, which she had set us up for very well. I learned I really enjoy being in a specific service line as well with great depth. So, not every service line, more focused on women's and children's, and becoming involved with legislation at the state and federal level for maternal and child health. And so that was just a unique experience in itself, working with organizations such as March of Dimes to develop the 39-week initiative. So there are fewer allowed elective deliveries before 39 weeks that are not medically indicated. So that was a really remarkable experience. And then fast forward, I'm in recent CEO role, led a 590 bed facility with all the services at the highest acuity at a 100-bed psych hospital as well as a college of nursing, and learned a lot about being the area hospital for a region, including serving as the COVID caliber hero hospital for those high acuity patients, especially with the Delta variant when people didn't know exactly how to care for them. We had all the specialties and providers that could do the best work to provide the best outcomes for them. So learned in that role how to be a team player with the community and smaller hospitals, how to maximize resources to benefit those patients that needed us most. And really enjoyed all of my roles within HCA through 23.
Awesome. The first thing I like that you've been enjoying your work and you are providing a really good services to community. And I think the way you work so far means it's been a long time. Like so you work with everyone in terms of hospital clinicians, nurses, their day-to-day operations, even any complex situations or so that's I think makes your experience are really unique. And then, three-time, CEO, I think that is amazing. So I'm looking back, or I try to remember we had a quick conversation before this, and during the pandemic, you described staffing conversation as a feeling like a hostage negotiation. What was really happening behind the scenes?
Yeah, so it's interesting. I know I shared a little bit about my historical roles, and even before I joined HCA and I was at a pediatric nonprofit hospital, regardless of if it's nonprofit or for profit or pediatric or adult, staffing's always the number one challenge. I mean,
Mhm.
we're in the business of people taking care of people. And so
Right.
over, 60% of cost, usually it's around 80% of a hospital's cost is labor, and every facility is challenged with having enough people to take care of their patients. And so while they try to plan to the best of their ability, volumes fluctuate. That's always been the case. And the way that healthcare leaders have approached that problem historically is by going to traditional staffing agencies and saying, hey, I need, two more ICU nurses. And traditional staffing agencies have a employed pool of talent, and they are looking at their talent, skill set, and where they can work. But that agency is getting requests from several different facilities and determining where to direct that person to go. So my personal experience during the pandemic was every organization, every hospital needed more staff. We were bombarded from the
I agree.
complexity, acuity, you can imagine. And so we were all competing for the same talent pool. So we would reach out to the
Right.
traditional agencies and they would say something, Drupal, like, hey, if you want that ICU nurse tonight, they're going to be $200 an hour. You want them or not? If not, we'll go down the street.
Oh, wow.
And you know, the traditional agency tells the leader what the bill rate is,
Hmm.
but that bill rate is split between the actual healthcare provider and the agency. But as a leader in
Right.
an organization, we don't know what percentage is going to each side. And so it happened numerous times on a daily basis where I would need more staff to accommodate patients that were trying to be transferred in for our higher level of care. I'd call the agency, wouldn't be able to meet the rate requirement because it was I'm so outrageous and therefore
Hmm.
couldn't care for those patients. And I thought to myself, okay, who's in control right now? And it was a traditional, staffing agency. It wasn't anyone actually taking care of patients. And so I thought to myself, how can I develop a model where the people actually caring for patients own the control? Let's take it away from the agency. Let's put it back in the hands of those actually taking care of patients. And so I started to model this out, and that was the impetus for building MedCurate, was to give control back to the people taking care of patients, increasing pay for the providers, and decreasing cost for the facilities at the same time.
Right. No, that's really amazing insight. So how long it will, I mean, I know you, how many years, since you opened that MedCurate, then you realize this is the moment that I need to build something new.
Yes. So after being a corporate executive, it's really challenging to consider becoming an entrepreneur. But I made that leap of faith and left in spring of 23 from my corporate role. I decided to file for the company in mid 23 and built out the technology platform the second half of 23. So we
Hmm.
launched with our first hospital in February of 24. So we're coming
Okay.
up on 2 years in just a couple weeks, and we will be at, well, as of today, we're at 73 different healthcare organizations across 9 states. So
Right.
we're continuing to grow with our current partners, and we appreciate the opportunity to partner with new organizations as well.
And for someone hearing about MedCurate the first time, for them, what is a MedCurate in a simple term and who is it built for?
Yes. So MedCurate is a digital marketplace matching healthcare providers looking to fill extra shifts with
Mhm.
healthcare organizations looking to fill them as well. So you can think of it as Uber, but instead of drivers and people that need rides, we have healthcare organizations and healthcare providers where they're able to directly see those specific opportunities that meet their licensure, competencies, and credentials. They can see the rate that they're going to be paid directly from the facility. So I call it transparency, like Southwest Airlines, where we show it exactly so there's no question on what's the bill rate versus what does the clinician get paid. So right now, we support
Mhm.
every role that's credentialed through human resources. So not currently offering physician or mid-level coverage, but every other type of role in any type of care settings.
Awesome. So walk me through that real scenarios example. I signed up, I got credentials, I went through the whole process, onboarding process, and now I open or like Sift opens up and what next? What happened next? Like it's just a high
Yeah,
level workflow.
sure. So when you join the MedCurate platform as a clinician, you get to set your preferences. So are you interested in seeing opportunities that are days versus nights, Monday
Mhm.
through Friday versus weekends? And our technology matches your licensure, competencies, and credentials to the job descriptions of the shifts that we help fill. So through that, you'll only see opportunities that you are licensed, competent, and credentialed to see. So Drupal, you would log
Mhm.
in. We have Apple app and Android and web-based,
Mhm.
and you could click add a shift. When you do, it will show you all the different opportunities for you to pick up based on what you're allowed to see. And so you, Drupal, may already work 3 shifts a week at a certain facility, but you're looking to pick up a 4th shift a week. Because most clinicians work 12-hour shifts, they're typically working
Mhm.
3/12s, which means they have 4 days off, up to
Right.
potentially. And so sometimes they say, you know what, I work 3 12-hour shifts in a hospital OR. I want to pick up an 8-hour surgery center shift on Fridays to supplement my income. So you are in control through this app as a healthcare provider, choosing when and where you work. So we have some that use it to pick up 1 or 2 extra shifts a week. We have others that choose to use it to fill out their entire work schedule, but that's up to the clinician. There's no set requirements for them of how many they
I
have
see.
to do.
Oh, no, that's like it is like a very streamlined process. And then again, yeah, you don't need to go through that conventional
Mhm.
agencies and then all kind of pain. And then again, that you can directly work with organizations.
Yes.
So
Yeah, and I
yeah.
think one of the main points too, that we hear our clinicians really appreciate, they actually clock in and out through the app. And so when
Mhm.
they clock out, it notifies the organization that they have clocked out of their shift, and the organization has up to 72 hours to review and approve it. The moment it's approved, that clinician receives payment through a payment platform integration that we have. So our clinicians are typically getting paid faster, getting paid about 20% more, and they're choosing when and where they work.
Right, right. So is there any like a specific or what makes this model fundamentally different from the traditional staffing agency? Do you see, I know from clinician perspective, from nurse perspective, it's very ease, on hand. They can do everything, select their schedules, rate and their locations. From experience perspective, or are we hiring a good, or deliver a good, experience RNs, to clinicians, to organizations?
Yeah, so from a clinician perspective, I think what's different for them is they're self-directing their own work. So they're independent
Mhm.
contractors and they are not employed by MedCurate. So they get to choose when and where they work versus being suggested, you need to go here. Here's an opportunity for you. We're being very transparent in that. Also, they don't have a commitment to fill. So if they
I
were
see.
to be at a traditional agency as a W-2, there's often hours requirements that they have to work a certain amount, which might not work for their schedule for one reason or another. On the healthcare organization side, traditional agencies typically have 8 or 13 week contracts. So you maybe a hospital needs or a surgery center needs to cover a 2 week honeymoon. They don't need an 8 or 13 week contract to cover 2 weeks. So with our model, they can choose the duration of that commitment and posting. It's oftentimes 1 shift at a time, or it could be a block of shifts, but they have a lot more flexibility in actually posting their exact need versus trying to fit into the agency model.
It sounds more fascinating, and then I'm kind of more curious, more as we speak.
Yes.
But
Well, I think that's
so
the biggest challenge is educating on what the opportunity is because it hasn't
exactly.
existed historically.
Right. And that's what my question, like you are now operating across multiple states, organizations. What surprised you most as you scaled?
Well, it's been a great journey, first of all. I learned something every day. But I think one of my assumptions, which was wrong, was that it would be a primarily millennial, more tech focused healthcare provider that would utilize the platform. What I have realized is we have a very broad spectrum, but there are a lot of clinicians that have been in the workforce for 20 plus years that are saying, I love taking care of patients. I just want to be able to have more control. Maybe I can't do 3 12-hour shifts a week, but I can do 2. And so instead of them retiring or going into another profession, now they're staying at the bedside, which I'm sure your viewers are very well educated. There's a massive shortage of healthcare workforce. And so if we can keep people doing what they love longer, as we have the baby boomers aging and exiting the workforce in general, that's going to be helpful. So I think what's been surprising as we scale is really the broad spectrum of healthcare providers that we serve and it not necessarily being millennial focused. We've designed the tech in such a user-friendly way that anyone can use it. On the
Right.
facility side, we've found some really great partnerships outside of hospitals as well. So, for example, surgery centers, they may have a new surgeon that wants to operate on Fridays, 1 day a week. And it doesn't make sense necessarily for a surgery center to go employ a whole team of people for a
True.
surgeon for 4 days a month. And so we've built really strong partnerships with surgery center organizations to basically send a team that matches the block schedule so that we're maximizing their cost and productivity as a result. So I've really enjoyed learning all the different areas of healthcare that we can serve, including surgery centers, post acute, and home health.
And I like the one phrase that the technology that you build, it's easy to use because the adoption, it's the biggest challenge in the healthcare. Like, so yeah.
Yes, I read or I heard a meeting, they called it the
Hmm.
technology paradox of the United States, where we are oftentimes highly advanced in technology, but slower to adopt, where perhaps other
Exactly.
countries are more ready to adopt, but not as advanced. And so I think that's something I experience daily.
Right. No, I agree. So when you zoom out, what's changed the most in the healthcare staffing over the last 2, 3 years?
So it's interesting. During the pandemic, a lot of the traditional agencies really had the opportunity to grow margin and headcount because of the pandemic. And so I came into this when the volume of requests and the acuity of patients and the needs for agencies was technically going down from the pandemic. So a lot of agencies were trying to exit the business when I was just entering. And I had a lot of
Right.
questions of why did you try to enter it? It was so much better during the pandemic because of the macroeconomics. And so for me, I think it's been interesting to watch traditional staffing agencies kind of rebase in a post-pandemic era and try to think through how do they navigate forward with their traditional model in an environment that's demanding change now because it can. So I think that's been the most fascinating part to learn.
Mhm.
And being a tech company, we're constantly evolving. So as we hear about best practices or features, we're called MedCurate because we can curate a solution for any scenario. And so continuing to curate as we go what best meets our partners' needs.
Right. Right. So thank you so much for sharing that insight. So my next question, as MedCurate grow, what's been most complex part of scaling? Not necessarily the hardest, but the most nuanced.
Yeah, I think, as you grow a business, we really offer concierge white glove service. We are healthcare providers, clinicians, and healthcare leaders ourselves within my team. And so we felt the pain points they have felt, right? We know what it's like when you got to staff your unit on, Valentine's Day night and you have four call-ins. So it's continuing to have that service level that we are committed to providing while you grow. And so, what are the tasks that we can automate through technology so that our team members can be focused on the service elements for our partners as we grow? We don't want them to feel that we're growing. We want them to feel like they're our primary customer on both sides of the marketplace. So, it's really being strategic and what resources we add, what task items can we automate so that we can focus more on the human touch
Mhm.
as we work with our partners. And I think that's going to be a constant evolution, which is what makes it so interesting as an entrepreneur to continue to iterate and balance that. I'd say that's the other piece, Drupal, is when you have a two-sided marketplace, you're always
Right.
balancing, demand and supply. And so
Right.
figuring out how to do that more strategically to ensure that we're having continued great fill rates for our partners and great opportunities for our clinicians.
Right. And where do you think tends to slow down the most as you grow or as you scale?
So
Any?
I think my experience has been the larger and more complex the health system, the longer and more complex the sales cycle. And so, from a business development perspective, it's continuing to focus on those larger opportunities. But we really do a great job partnering with freestanding facilities as well because they have immediate needs. They can make decisions locally, real time, and they really feel that benefit when they're taking care of their community. And so it's a balancing act of continuing to support and grow your solo or few site organizations while we also work to incorporate larger national health systems onto the platform.
What? And when you think about next 12 months or 16 or 18 months, what does a great year look like for MedCurate?
Yeah, a great year for MedCurate is we're continuing to progress and better meet the needs of our partners. So, in the coming weeks, we are launching MedCurate Enterprise, which is a white label solution for a healthcare organization that can utilize their own instance of our technology to manage their own employees. So it will have the same
Right.
features as our traditional model, where they can deploy and notify clinicians of open shifts within their own organization. And if it's not filled internally within a certain time frame, it automatically gets connected to the MedCurate platform where our clinicians can help fill those shifts as well. So a successful launch of that in early February and growing that offering to our existing partners and future partners as well would be very successful. So we can take 60% of the time leaders spend is on healthcare staffing. If we can give them
Okay.
back a good amount of that time where they can focus on taking care of their own employees and patients, that's a win for
Hmm.
us.
Right. And what would make you look back and say, hey team, we really moved the needle? Like, is there any metrics or is there any kind of a goal that you're looking for?
Yeah, so we have KPIs for the organization. We're an EOS organization as well. So we look at those weekly, quarterly, and annually. But provided that we're performing on those, so a great fill rate, which means our people are having opportunities and our organizations are getting what they need. Great
Hmm.
retention of our current healthcare providers and healthcare organizations. So we have fantastic retention rates. So continuing that as we scale, I think will be a sign of we're building the model, we're meeting a need, and we're removing pain points for everybody.
Awesome. Awesome. Listening to your journey from hospital leadership to founder, what's one belief you hold now that you didn't earlier in your career?
Ooh, I I think my thoughts around failure have changed.
Hmm.
So, I was accustomed to a lot of metrics in a corporate environment and meeting those metrics and delivering and reporting on them regularly. As an entrepreneur, there's a lot of moments where there's not necessarily a metric identified for something that you're working on. And so being able to identify failures quickly and pivot and embracing those and learning from them. Learning you need to go a different direction is not a failure. It's a blessing to help you figure out how to do something better. And
I
so
agree.
that has been more of a personal journey than a business journey, but something that I'm trying to make sure my children know as well. I have a good friend, Joel Goldberg, who works with the Kansas City Royals, talked to me and in a podcast, and he said, baseball players, if they're batting, 300, they're some of the best of the best, which means they're failing 70% of the time. Like,
Right.
just think about that. Like they strike out, whatever the case may be, and they have to get right back up there within an hour to do it again. And they're not letting
Hmm.
that last at bat ruin their current performance. And so, how to be quick to respond and move forward in a way that's
Hmm.
productive, that's been something I've really honed in on the past few years.
Awesome. So for healthcare leaders wrestling with workforce issue right now, I know that is the biggest issue.
Mhm.
What's one thing they should rethink?
I'd love them to rethink how they approach their supplemental staffing. We'd love to come alongside their existing solutions. I finished my doctoral work in 24 around how to support the clinical workforce of the future. And the research talked about individuals that have a say of when and where they work and for how much have better satisfaction, lower turnover, better retention. And so I'd like them to be thinking about being open to an alternative approach to supplemental staffing, and we're glad to come alongside existing solutions to see how we can complement what they're currently doing and improve their expense and experience.
Thank you so much. And where can people learn more about MedCurate or follow your work?
Yeah, so please, you can find out more about MedCurate at medcurate.com. And if you want to set up a call or demo, you can email at medcurate.com. And we're on all the socials, so LinkedIn, Twitter, Instagram, Facebook. So we'd love to connect with anyone on the provider side or organization side to hear how we could help curate their staffing.
Ashley, this was such a thoughtful conversation. Thank you so much for work you are doing and for sharing it so openly, I would say. So
Yes.
again, I really appreciate your time and your insightful. So thank you so much. And thank you, audience. And we'll be signing off.
Thank you so much for having me.